Hello, I'm Priya Jagathisan, one of the neonatologists at Santa Clara Valley Medical Center. Today we're here to talk about delayed cord clamping, which is a very important quality intervention that's done at all three institutions within our system at Santa Clara Valley Medical Center, O'Connor Hospital, and St. Louis Regional Hospital. When a baby is delivered, instead of immediately separating mother and baby by cutting the cord, we allow the baby to remain connected to the placenta via the umbilical cord to the mother for an extra few minutes. This process of waiting a few minutes is called delayed cord clamping. If we cut the cord within 30 seconds after birth, that's considered early or immediate cord clamping. For centuries, birthing practices involved waiting for many minutes after birth before cutting the cord. In 1950s, this process of waiting was changed to immediate cord clamping without recognizing the importance of waiting. In 2006, World Health Organization, after reviewing all the benefits of delayed cord clamping, recommended waiting at least 1 minute before cutting the cord. In 2007, in our institution, we started waiting for at least 30 seconds before cutting the cord. Later on, we increased the waiting time to 1 minute in 2011, and now we wait for 3 minutes before cutting the cord. Waiting these extra few minutes allows the mother's placenta to continue to support the baby while the baby is adjusting to the new environment outside mother's womb and while the baby is learning to breathe. Another important change while waiting is there is an additional 3 ounces of blood that is transferred from the placenta to the baby. This provides tremendous benefit to the baby. Babies who receive delayed cord clamping can breathe more easily, and the extra blood gives them more nutrition, more stem cells, and more blood cells to carry oxygen to their body. Research studies done in term babies has shown that babies who receive at least 3 minutes of delayed cord clamping have less anemia later in the first year of life and have better brain development in the first few years of life. They also have better social skills and fine motor skills at 4 years of life. We all know that better early brain development will provide the best start for all children and will allow them to thrive in the future. When we initially started doing delayed cord clamping, one of the concerns was this may cause more jaundice in babies. However, we have been following the babies and there is no increase in jaundice in babies who receive delayed cord clamping. This has been extensively looked at in research studies. There is no negative impact on mother's health. At the time of delivery, if there is a concern of maternal bleeding, then we would cut the cord sooner than 3 minutes.
My name is Dr. Dongli Song, one of the neonatologists at Santa Clara Valley Medical Center. I'm going to talk about the benefit of delayed cord clamping in preterm babies. Delayed cord clamping offers more benefits to preterm babies, especially to very preterm babies who are born 2 to 4 months earlier than their due dates. Those babies at high risk of very serious complications that may lead to death or long-term neurodevelopmental disabilities. Delayed cord clamping helps those babies transition at birth, decrease their risk of anemia, infection, and bleed in the brain. Delayed cord clamping saves their lives. A large international study has shown that at least 1 minute delayed cord clamping in preterm baby increase their chance of survival by 30%. Santa Clara Valley Medical Center is one of the few first hospitals in the country practice delayed cord clamping in preterm babies. In year 2007, we started to perform 30-second delayed cord clamping. Over the past 14 years, we have gradually increased the duration of DCC from 30 seconds to 3 minutes to maximize the benefit of this amazing yet simple birth process in this high-risk population. Very premature babies born in this hospital have better chance to survive, less complications. On average, those baby goes home 1 week earlier than babies born in other hospitals in California. This is reflecting our excellent perinatal and neonatal practice, including delayed cord clamping. We have conducted a series of clinical studies to evaluate the feasibility, safety, and benefits of delayed cord clamping in preterm babies. In our first study, we compared outcomes of very preterm babies who received 30-second DCC with babies who received 60 to 90-second DCC. Our study demonstrated that the additional 30 to 60 seconds of waiting allows more blood transfusing from the placenta to the baby. We published the first study to demonstrate that the baby received a longer duration of DCC, had less difficulty to breathe, therefore had less need to be placed on the ventilator to support their lungs. In a subsequent study, we look at the data from over 400 babies who received delayed cord clamping. We published the first normal standard of red cell numbers in preterm babies who received delayed cord clamping. We also evaluate delayed cord clamping in multiple births. We demonstrate that delayed cord clamping can be done safely in twins and triplets, with similar benefit seen in singletons. One of the important questions is if the longer duration of DCC help those very premature babies' long-term neurodevelopmental outcome. In fact, our follow-up study have shown that the baby who received the longer duration of DCC had better brain function at 2 to 3 years of age.
We're very proud to say that we are one of the first hospitals to provide 3 minutes of delayed cord clamping for all our mothers and babies. We believe that every mother and baby should have this opportunity of 3 minutes delayed cord clamping and experience this simple yet amazing birthing experience.